Hi, I'm Dr. Angie Aboutalib. I'm a hospitalist and National Director of Quality and Education for U.S. Acute Care Solutions, and today I'm going to be talking about time-based coding in 2023. So as I previously discussed in the other sections, the two ways that we can code now for inpatient observation, same-day discharge, EM codes can either be selected in either MDM or we could use total time. So keep in mind, this has nothing to do with emergency medicine codes. These are excluded from the time-based coding. So we're going to be focusing on time-based in this section. So in the prior sections, I talked about the MDM criteria. Now let's talk about the time-based requirements. So let's first discuss the 2022. So what has been required of us? Well, they stated for us to really use time, we had to do more than 50% of it counseling and coordination of care. So we had to actually document more than 50% of the time was spent counseling and coordinating care. In addition, your documentation had to actually include the conversation that you had with the patient. And they had something called the Midpoint Rule, which applied for this. And so in this case, if the time documented passed the midpoint between two EM codes, you were allowed to round up and report the higher EM code. Again, this is 2022. This is what we're currently doing. Well, 2023 has changed now. They are completely eliminating this counseling and coordination of care. So it's no longer something that is going to take place. Instead, they also want to shift from this typical time to total time. And the total time is going to be time spent performing certain activities associated with the specific patient encounter. So I'm going to talk more about that later and how we document that. Let's talk about the midpoint rule. Yeah, they removed this completely. So that's not going to be a thing. They actually want us to either, the total time has to meet or exceed. So that's the main thing. And essentially, this is documentation that has to meet or exceed the AMA CPT requirements to be able to bill for this. So no midpoint rule anymore. Let's give an example. 99223, inpatient observation H&P, 75 minutes must be met or exceeded. New times were also created for inpatient observation, as well as same-day admission discharges, EM codes. So there is a significant increase of time to report for these codes. So if you recall with the MDM, they're requiring for us to actually document really thoroughly because they've taken out all of the other elements, the HPI, the family history, the review systems. Same thing with total time. They're saying if you're going to use total time, you have to spend more time with your patients. So let's look at the difference between 2022 and 2023 to compare how much time we have to actually spend with the patient to be able to bill for that code. The other thing is total time on the date of the encounter refers to a calendar date, and I'll talk more about when encounters cross the midnight after later on in this section. So here's an example. Let's take a look at the H&P. If we look at 99223, in 2022, it was 70 minutes, and in 2023, 75 minutes. If we look at the subsequent care, 99233, it was in 2022, 35 minutes, but in 2023, it's going to be 50 minutes. And same day admission and discharge, 99236, in 2022, 55 minutes. And guess what? For 2023, it's 85 minutes. So definitely when it comes to the time, they want us to spend some more time. Now, when a continuous encounter crosses midnight, this encounter is a single service and is reported on one calendar date. The total encounter time may be applied to the single reported date of service. And so CMS further clarifies that the reported date of the service is the date the encounter begins. Documentation requirements that they need from us. So they want us to document the total time. So this is face-to-face, but guess what? It's also non-face-to-face. So what does this mean? I went and I saw my patient, then I went back, did some orders later, And then I also discussed with the consultant some information. I reviewed the chest x-ray that came back. So there was a face-to-face component of it. But there was also a non-face-to-face. And so from there, I'm adding up the whole time that I spent on this patient in order to bill. And here's the key thing, regardless of the location. So let's say I saw my patient, I examined them, and then after that I went home, I ordered some more labs, and I went on the computer and I checked up on their other labs. It doesn't, regardless of location, the provider doesn't have to be in the building every time. You're also doing additional work on this patient. So let's review. What are the things included in this? So preparing. Before I see my patients, I always prep my notes. I look at their labs. So that's included in time. Obtaining and reviewing a history from the patient, performing a medical appropriate examination, and counseling and educating the patient and the family and the caregiver. This is all added. And ordering medication, tests, or procedures. So these are all components that are included. Referring and communicating with other healthcare providers. Documentation, so when you're writing your notes, that actually gets included in the time. And independently interpreting results. So, and communicating the results to the patient's family or the caregivers. So I read the chest x-ray, I went back and I discussed this with the family and had a family meeting. So all of this is the time I've spent on the patient. And the care coordination, okay? So what's excluded? So what are things that we cannot include in time? Can't include that I traveled, my travel time. So if it takes me an hour to get to the hospital, that's not included. Teaching. So I can't include the time that I sit there with my medical students and I talk to them about chest pain in general. That's not included. Time and activities normally performed by the clinical staff. So if a patient asks me to bring them a blanket, I can't add that into the time. And any time spent in performance of other separately reported services. So MDM versus time. So again, you can determine if you want to do MDM or time, total time. This means if total time is included, you can also use your MDM. So let's give an example. Let's say you have an inpatient HMP service 60 minutes. So that's the total time documented. And your documentation also supported a high complexity of MDM on the 2023 MDM grid. It would be acceptable to report the inpatient HMP EM code 99223 because the high MDM is supported. So what this basically says is it doesn't hurt to document time because they can always use the MDM if it's actually higher. So that's kind of a way to, if you want to include both, they're just going to pick the MDM or the time spent, whatever's higher. Now, inpatient OBS discharge. I mentioned this before, but this is just a recap. Time should be documented and should be as specific as possible. Remember, they don't want us saying less than or greater than. They actually want us to state 30 minutes or more, or 30 minutes or less, or 31 minutes or more. And then if you will have additional questions regarding the discharge summary, you can refer to this section. And this concludes this section. Thank you.